252 or 7525?
Oh, is it?
Yeah, I got
Terrible with numbers. It could be
try them
25,
both.
26.
Yeah.
Okay.
So it's 635 7525 or 635 7526. Okay. 811, let's go into the Zoom room where we have the Physicians Advisory Group Chair, of course, Dr. Hoa Wen. Morning, Doc. Morning, Doc.
Good morning, guys. Good morning. There's a lot of confusion, and I think that Janetta tried her best to clarify some point this morning on testing, and I'm going to try to clean up a little bit more mess in the testing, so that way I hope that most people will hear this message, so they can have a right idea what we do, because the PNC news yesterday is really a mess. It create a lot of confusion. So, okay, so let me clarify this thing first. Okay, all the tier 2 clinic, I mean that AMC, FHP, SDA, seeing all the patient. Doesn't matter you have insurance or not insurance. We don't refer you to public health. If we can fit you into our schedule to be seen, you will get seen. Okay. Now the difference between the tier 2, the 3 big tier 2 clinic is that only AMC have the Abbott machine. That's the point of care testing that we prioritize for the sick visit, because we want to identify the people that have the COVID-19, so we can isolate them. Okay, so all the tier 2 see everybody. It doesn't matter if you have private insurance or no insurance. Okay, but again, it's depending on how much people we can fit into our schedule. Our schedule at AMC, we see about anywhere from 30 to 50, 60 patients a day. Okay, as much as they show up, we try to see them. Just they have to wait. Now, a lot of people go through the AMC before. You go in and out that 4-room isolation, and there's no money exchange there. It's completely at no cost to the patient at all. Okay, now with SDA and FHP, people can understand they don't have Abbott machine. So when they see sick patient, again at no cost to the patient, they have to do testing. Either they send the test to public health or they send the test to DLS. If patients have insurance, they send it to DLS to be run because they can access the system a lot faster to retrieve the result for the patient a lot faster within 24 hours. If patient don't have insurance, they send it to public health to be run, and that process slow down a little bit. Sometimes you get the return time for a day or two, but the no clinic in Guam can have access to public health database. So we have to wait to public health contact the clinic for the result. So that's what the inconvenience about that one. Okay, but so they don't know. There's no cost, but somebody have to pay for it. So basically, private insurance with SDA and FHP, they go to the private insurance if you're sick. If not, then they go to public health with the testing. But those two big tier 2 clinic will see everyone. Doesn't matter you have insurance or not. Now there's 2 tier 3 clinic, which is One Love Pediatric and also Dr. Gago of One Medical Care. They also have the Abbott machine that they will also see patients that are sick that go through them at no cost to the patient neither. Okay, so those are availability for the people that can come in. Now, the only time that patient pay anything at all, if let's say you go travel clearance, you go to Hawaii for vacation,
yeah.
they going
how many weeks am I going for?
Okay, because you cannot bill that to the insurance. That's your vacation time. No insurance, no public health will pay for that. So each clinic depends the fee schedule that will charge the patient to get tests because you go to Hawaii for vacation. Someone have to pay for DLS. Will not run for free because they are a private company. Okay, so they charge you $125 or so to do the test to go to Hawaii. Okay, and the clinic to recoup the cost for the manpower, they're going to charge you from the manpower fee. So that's the only time that they get charged on for the COVID testing. Also, big company, they they do their own close contact tracing. Sometimes they request 30, 40, 50 tests to take care of the employee, and that's between the company and each clinic that do that. Okay, now the executive order that the governor have only exists through the tier 2 clinic and some of the tier 3 clinic. But other private clinics like Express Care or ISP or any other small clinic, they are not bound to be under the executive order. So, they can do whatever they do, okay, ethically to charge the patient, recoup the cost. That's up to them to do that. But, the executive order does not, have any authority over the small private clinic. So that's only applied to the tier 2 clinic and some of the tier 3. Now, when we see patients for COVID-19 testing, every clinic will prioritize the patient depending on their symptom. Because if you don't prioritize them, you don't have enough times a day or manpower to swab everybody, on the island. So what we prioritize, and the number one that will go first, if you have any symptom. If you're symptomatic, they're going to try to squeeze you in as much you can and see you. Okay, we don't like to turn away sick patients because we need to identify anyone that tests positive for COVID-19. Number two in line is the close contact. We will triage you on the close contact to make sure that the exposure time is adequate for us to do the testing. Because if you come in too early, you exposed someone yesterday, and you come in tomorrow, it won't be positive, but you still carry the virus. So we kind of ask you to quarantine yourself at home, appropriately about 5 to 6 days after you get exposure. They will test you, and usually they give an appointment time, so that way you can get tested after 5-6 days post exposure. So that's number two on the line. And number three is anything else that people request to. You walk in and say, I don't have no reason, but I want to get tested. Those are the last option that we have. We're going to try to see them to get tested, but they're the last priority the most. So we prioritize them based on their symptom, based on close contact, based on reason why they want to be tested. So, but guys, when it's at no cost to the patient. Seriously, I mean, most of you guys go to MC before. You go in, you go out. There's absolutely no money involved, no payment, nothing, at no cost to the patient. Remember, depend on clinic, they have Abbott and no Abbott. That's a big difference. The confusion on top is that if you have no Abbott, diagnostic lab is a private company. They will charge the patient or the private insurance for the test to be done in their lab. So again, all the providers are trying their best to find reason to build the insurance rather than put the cost on the patient. Okay, so when you see the patient say that, why have to pay for this one? Just because if if the provider find no reason for you to be tested and you would like to be tested, then they have to put a charge there, because that charge is go to diagnostic lab for running the test. Okay, so I'm not sure I answered on the question, but I think that will clarify a lot of stuff. So again, tier 2 is under the executive order. That's what I agree with the governor, that no tier 2 should be charged any patient, okay, unless they travel for personal use or for company. But for the rest, depend on you have to Abbott or no Abbott. Okay, so that's the kind of the short summary of what the testing is all about. Okay, so I hope that clarifying and any question or concern that people have.
Doc, is Guam Radiology a tier 3?
Radiology is considered tier 3.
Okay.
Now they have, because of nature of their business, they have a lot of patients that go in there that for emergency, radiology study. Just like you have a if ER call them or clinic call them, say I need to do this thing stat, and so they need the ability to test everyone that come from the inside the door because you lay on the CT scan. They do invasive procedure for you in their clinic, and they need to know those patients are positive and negative because they take a lot of risk exposure to their staff. When the patient come into a private clinic to be seen for sick, we minimize the contact time of the patient. Usually, as you can see, the contact time is 15 minutes cumulatively. But remember, those patients that go to radiology, they stay in there sometimes for MRI for 2-3 hours. So they do tests on everyone that go into their clinic to do procedure just because there's a huge exposure time for them on the patient because it's not 5-10 minutes, it's several hours for a patient to lay there during the radiology study. So they have an Abbott machine there on their stuff, but they are considered tier 3 clinics.
Right. How was it decided who was going to get the Abbott machines? Or
Yep. The Abbott machine, anyone can apply for the Abbott machine, okay, with the condition that you have to see patient regardless of payment. You know, the Abbott machine, patient are sick, you have to price high. Remember, you can't if they are sick, other clinic refer to you to get seen because they know you have Abbott machine. You will see every one patient, and you cannot charge them. They go in and they go out at no cost to anybody. And that's the point of care, and anyone can apply if they agree that they see every one patient. It's not just yours. It's not something that you use for your own clinic. You have to open your clinic to everybody. Like I say, regardless of payment, okay, you have to see them at no cost. And again, you don't use the Abbott for just travel clearance or anything that personal. You only use the Abbott when you have symptoms,
Right.
because that's a point of care machine. So again, a lot of headache to use them, a lot of risk, because that's what you see sick patient all day. You know, our 4 isolation room run from 8 to 6, and they don't stay empty. You know, one after the other, and that's what you do all day. So that opened to any clinic that want to do the same thing. It's not for any type of private gain. That's just a commitment to use for all the sick patient, like I say, at any clinic. So if you have a clinic call you, say I have a sick patient, can I send over? You know, you answer yes, send them over, and we prioritize them and see them, and they go in and they go out.
okay. So just again,
That's
for clarification, whether you have insurance or not, and you are exhibiting symptoms or maybe a close contact to somebody who is positive, you can go to a tier 2 clinic to be tested. But in order for it to be free, the tier 2 or tier 3 clinic must have these Abbott machines. And those clinics are AMC, One Love Pediatrics, Guam Medical Care, and Guam Radiology.
Yes, you correct there, Sabrina. But also here, don't forget FHP and SDA.
Right. But
They also see patient, but again, if you have private insurance, they try to do the test and send the swab to DOS to run. Okay, if you don't have insurance, then they will do the test and
sorry, Doc.
send to public health to run. That's the difference. But they will ask insurance to have it, so that way they can use it to public health. But there's no pay on those things neither.
Because your insurance would pay for it. at the tier 2
Yes, redemption.
FHB SDA that do not have the Abbott machine.
Yes, you're correct.
Okay.
Okay. But if you go to any other clinic that's not in the tier 2 or some the specific tier 3, then yes, the other clinics have the right to charge because I mean they are private clinic and they will charge. They do the same thing as a tier 2. Okay, they have a different pay structure, but again, they are trying their best to build the insurance rather than have the patient pay for it. But again, every time that you send a swab to DLS, patient have to sign a form from DLS say that if the insurance refuses to pay, that DLS will expect the patient to pay. So they have a form by DLS, not from the clinic or any clinic, not from diagnostic lab, that have the patient acknowledge that if the insurance don't pay, then the patient might be billed for it. Again, the DLS is a private company, that supply the equipment and do the testing. So we can't control what DLS does, but they are a very good partner, and they get the tests within 12 to 24 hours,
Right.
and the physician can access the database, and it's very efficient. That's what we for private insurance we like to use DLSs because it's so easy for us to get the result back to our patient as soon as possible.
You did mention though that you said you could apply. I guess that what clinics can apply for an Abbott machine. Are they applying to public health? And does public health have these Abbott machines stored in a closet somewhere?
Yeah, we have Abbott machine in public health. Again, if the clinic want to write to public health, I told them before, is public health, they will try to allocate an Abbott machine for them. That's just they just have to make sure that they do the paperwork correctly regarding reporting. At the end of the day, all the negative and positive, along with all the demographic, and also agree to see anyone that walk to the front door of your clinic. Absolutely, there's no pay for it. You just do it.
Right.
Sick, you just see them. Okay, and then that's the key. That's just to increase the access to care for people that are sick. That's all we want, is to make sure that we capture most of the sick patients,
Right.
and not turn them away.
Yeah.
Okay, that's doesn't matter how busy we are, and they just walk in and we squeeze as much as we can through that. And sometimes you exhaust your capacity. When you got 60, 70 patients a day, you can't move any faster than that because the room had to be cleaned, the room had to be sanitized after every patient. So you can only do so much because we close at 6 o'clock.
Right, Doc.
And,
I was talking with you the other day, and you were telling me about so many sick people going into the clinics. Can you tell us what you're seeing at the clinic level as a tier 2 at AMC? What kind of people are coming in to get tested, and how sick are they?
Yeah, they really sick. Just the Monday, Tuesday, our 4 patients, they really sick. They come in the clinic, the oxygen saturation down to 80s. They're huffing and puffing. So it's not a pleasant environment to work for. There's a lot of risk for the clinic to have an Abbott because they know you have it. So they're gonna come in to the location where there's an Abbott, and they present the sickest patient. And those again, most of them, I would say over 60-70% of them are still from family gathering, from people from house that visit another person's house. And that's what most of the positive that we have in the clinic is, because the family gathering still. And I know the governor tried to minimize that, and there's some executive order out there that try to prevent people from different house to come together. And we need help in that one. So mostly from house to house.
So Doc, what did you guys discuss?
And I don't.
What did you guys discuss last night?
What was Sabrina?
Luis- Oh no, what are you guys going to discuss tonight at the meeting? The Physicians Advisory Group meeting.
Uh, yeah, tonight, basically, we're going to discuss more about what action we need to do to kind of curtail the virus. There's some, the rapid the target testing that we want to talk about, okay, and how to move forward, how to approach this thing. It's not just a target testing itself. Once you identify this positive pocket, you have to continue to come back to the same place and not just one-time things and then you're done. Because remember, we identify it's going to be recurrence. So you just don't go there one time and that's it, you're done. You have to have a plan to keep going back to the same place, make sure that the initial problem have been fixed. Okay, so that's just something that we really have to do. If we just go in there one time and we just walk away and don't do anything to monitor, make sure that there's nothing fixed in those areas, and we will have recurrent positive in the same area. So there's a plan A, and then there's a plan B to follow. So we have to do something like that. And again, we still will try to push for reach out to the 20 to 40-year-old population that have the highest race positivity, and try to use a different platform to reach them.
Yeah.
Some of them don't nothing. So we're gonna do Facebook and
They were trying to have a concert, Doc. How stupid was that?
The young people does, try to reach. First, I have no comment to organize.
I know,
that.
yeah. Well,
So,
Doc, have you
we
heard?
have Halloween come up, so we have to be very careful.
Yeah.
Have you heard anything else? Any specific details about the public health? I mean, the COVID-19 public health enforcement regulations and the fines that they plan on imposing for people violating the governor's executive order? I know you had mentioned it a couple weeks ago that we needed to do more. We needed to put some teeth into the enforcement. Do you have any specifics? I mean, it was dropped in this executive order, but that was about it.
Yeah, we really want to push that a whole lot because Dr. Cabrera have a graph there that show Hawaii and Guam. I'm serious. It's beautiful graph that go up at the same time. But when Hawaii enforced their fine, they pretty steep, like 5,000. It's a huge amount of fine. Yeah, and that curve goes straight down. It's really a very effective way to make sure that we change the behavior of the people, right? Just like if you go, you drive down the road and there's a speed trap there, and it's just a warning that you go too fast. I don't care. I'm going to continue to go fast. But
you're crazy,
if I have a station of $250 to $500 fine, trust me, I see that speed trap, I will down. It changed people's behavior by enforcing the executive order.
Yeah, it's too bad we had to get to this point, though. Too bad our people didn't get their act together. Now they're going to fine us. What's the fine for not washing your hands 85 times a day, Doc? Do you know?
Culture.
What should the fine be if you don't wash your hands?
Yeah, so, it's just, but hopefully the fine will curb the virus for us, and that's the only thing we do. I think that close down any more restriction, it's very hard to do more restriction. We just need to enforce our executive order. So that's what we want. But again, I hope that people understand more about the testing on the stuff. Again, we still want to increase the capacity for testing. Public health still do around 300 tests or less per day. That's the capacity. The DOS about 250 per day. with all the average that run, so we're still kind of limited, probably about 500-600 tests a day max. We can't do any more than that. You know, so for us to move forward to contain this thing, now we need to increase the capacity to 1,000 to 3,000 a day, and not put a limitation on the clinic and testing, because sometimes there's this overwhelm the testing capacity of the island.
So how much are you going to be able to keep up with this, going at it every single day?
Oh man, I think you froze him with that question, Bree. Oh, there you are. Yeah.
You know, Sabrina, I've been down the governor and everyone else, you know, and yeah. Especially the past 2 or 3 weeks, all the staff on the big patient to be patient. Some the clinic get yelled at because people wait too long. But through lunch, we stack people so with that way we don't we see people through lunch. We try the best we can, but see 70 patients a day, every day, 6 days a week. It's a long day.
Right. Yeah.
Yeah.
Okay,
Doc, maybe
so-
we need to get.
appreciate you, Doc.
Yeah, we appreciate you. Maybe we need to get Dr. Jolene Uggan on again. Can you arrange that? Let her come on here and just song in some of these people. I'd love to have her on.
Patient. So it's that lady, we can't see her that much. So
I know you got pulled,
So-
Doc. Make it happen.
okay, you guys be safe, and again, you know, I hope Janetta and I, we clear up the confusion for you guys. So anything else, you know, you can always text me, and I try to answer as much as possible.
Thank you,
All right.
Doc. Thank you.
Thanks,
Appreciate it, Doc. Jay, what do we have in the KUM News Zoom room, Doc? Hold on.
We got virtual sweet spaghetti, Doc, with the banana ketchup.
Do you like the Filipino spaghetti? I heard you liked it in the PI on that mission you went on.
Yeah, with hot dogs.
I'm saying, okay.
Yeah. Take two. Take two.
Bye, guys.
Okay, bye. Sweet spaghetti, Jay. What?
Sweet spaghetti is not an acquired. Wait, where do you guys? Are you guys thumbs up or thumbs down on sweet spaghetti?
All the way, 2 thumbs down.
Really?
Sorry.
No.
Well, I like the spaghetti at Jollibee.